I was advised by a pilot that if you do, to remember to ask the crew you're flying in a plane and you hear this. Is there a doctor on board? Would you volunteer? Recently, this happened to me when I was on a flight to Hong Kong. And this is a scenario that a lot of doctors, including you, have thought about. I believe there are three things at play here. Legally, there's actually no obligation for you to help. Clinically or professionally, you have to consider your skill set and competence. And as much as possible, you do not want to work outside your capabilities. And consider the availability of other options. Are there more qualified people for this scenario on board that can help? If there's literally no one else that's available to help, is your involvement, even with a little bit of knowledge, even better than nothing? It's a tricky one. Now, morally, and that's the real question. If you have the knowledge and skills to make a difference, is it morally right to not volunteer to help? My view is pretty simple. If I have the skill set to help someone, then I will help. It does not make sense to me that those skills only apply to when I'm in hospital. If I was the patient, I'll be more grateful that there's this person that cares more about my life at that point in time than their own legal safety. So yes, by default, I will offer to help. Once I find out what the situation is and I find that this is outside my competence, then I would say so early. But I will still try to find ways that I can help. Remember, help doesn't always have to be in a medical form. It can come in the form of reassurance and support. Last thing, now I was advised by a pilot that if you do, to remember to ask the crew for a medical liability waiver form. I'm led to believe that most airlines should have this. I hope that helps.